Now it's time for Cleared to Play. Take you inside the tent, get you updated on the latest injuries in the Bay. Proud to partner with UCSF Health on this segment and bring in our good friend, Dr. Brian Feeley. Hello, good doc. How you doing?
Pretty good. I'm just reading the book, waiting for Bosa, but I haven't gotten to the ending yet.
Tell me how it goes.
Is it a good book or does it stink?
It started off really good. It seemed like there was a good protagonist. There wasn't really an antagonist. And now, I don't like any of the characters.
No joke. And none of us like where we're sitting with game one being only 5 days away. We've been waiting all afternoon to ask you this, Doc. What would be, in your medical opinion, the safe cutoff for when Nick could sign and still play on Sunday?
Yeah, I think it's hard to say without knowing what condition he's in. So I think realistically, if he's been staying in great shape, which based on his past performance and history, probably in amazing shape, he could probably sign Thursday, Friday, and meet the team and play a limited number of snaps Sunday. If he's deconditioned, it can take 3-4 weeks. The likelihood of that, almost nothing, knowing the little we know of Nick Bosa and his past history. He will be the first person wanting to get on the field when he is signed.
In terms of conditioning, there's athletic conditioning that he's doing as an individual who loves to work out, and then there's football conditioning in terms of going through the rigors of tackling and contact and the rest of it. How much of that is of some sort of a medical concern, the body toll that it takes to go in and play tackle football to get that part of your musculature ready?
Yeah, I think it's a good question, because on one end it's, the less hitting you get cumulatively for the season, the better off you are. So this might be the best thing for an elite player that doesn't need a lot of reps, that he minimizes all contact until it's the first real contact. On the flip side, it is nice for your body to get used to the idea of performing with your heart rate elevated to its max rate for a number of plays. So it's probably nice if he had been able to get a few reps in the preseason. It'd be nice for him to practice, but I don't think it's mandatory, and I don't think it's necessarily detrimental 2, 3, 4 weeks down the line.
Doc, there are a lot of people who have just had a fantasy draft who now have a big lump in their throat because their first-round draft pick, Travis Kelce, left practice with a hyperextended knee today. Now, to give everybody the news, the Chiefs say they feel like everything with the knee is, quote, intact. However, there's swelling, and so the thought is he's probably unlikely for Thursday, but maybe has escaped something serious. But when you see that, the hyperextended knee, how would you sort of translate what Travis is looking at to our listeners?
Yeah, so based on the reports, it was bad enough that Andy Reid stopped practice and stopped the press conference after a couple minutes. It happened right in front of him, so it was obviously witnessed. And I think it really depends on what the imaging shows. I think the best comps really are in the NBA because we see a lot of these. And if you think back to 2017 when Durant had this at the start of the playoffs, he missed a couple weeks. Giannis had this 2021 and again missed a couple weeks. But when you talk to both of them, they said their knees felt really unstable during that time. So assuming there's no structural damage, he's probably going to miss a couple weeks. So that's out for this week, probably out for the next week, maybe out for game 3. However, if there is structural damage to the PCL, like Lamar Jackson, you're looking at either a prolonged recovery to get the ligament to heal or surgery so that you can come back the following season. You can also tear your ACL with a hyperextension injury. So until there's imaging, really all bets are off. Now, it's a good sign that they said the ligaments felt stable on exam, everything felt stable. But until you see imaging, you don't know for sure.
George Kittle possibly going to be sidelined with a groin injury. What would you consider to be the timeline for him to return based on the severity, considering that it seems to be somewhat mild?
Yeah, I think it's mild, but now we're looking at going on the 4th week. So when you look at NFL players, on average, they miss 3 to 4 weeks with a groin strain, independent of how severe it is. More than even soccer and baseball, they tend to miss 2 weeks. This is what kept him out part of last year, too. He missed the first 2 games with a groin strain. So anytime there's a recurrent injury, you worry a little bit more. You're going to take it a little bit more carefully. assuming there's no anatomic problems, like he doesn't have a sports hernia, he doesn't have any problems with the hip, I would imagine that if he took an extra early game off, it's not going to be a big deal. The bigger concern is there an underlying predisposing factor for him, especially as he turns 30? Is this going to be something that really crops up every single year or multiple times within this season?
Doc, their kicker, Jake Moody, the rookie, has a quad issue. He is back at practice, but was only kicking like 30, 35 yarders, basically extra points on Monday. How would you handicap this situation?
I feel like our kickers are often handicapped. I think it's always dangerous when a kicker has a lower extremity problem. Anytime they have a quad strain, I mean, one question is, it was a quad strain in the last in the last preseason game, but I wonder if he wasn't dealing with just something that felt different to him. He was kind of up and down all preseason.
True.
And that was very inconsistent from what he was like in college. So maybe this was something that kind of forced some rest, will allow him to be fully recovered, and then he can go in and feel really 100%. Honestly, I don't know. I would be, anytime a kicker has any lower extremity problem, I really want us to have a win in hand by the second quarter so I don't have to think about it.
Doc, did you just take an unnecessary shot at Robbie Gould in the process of that answer? I didn't know, like what, is there beef here?
No. That was an old Ray Wershing beef. I'm not bringing up the mid-'80s.
What's your beef with Ray Wershing? He was fantastic.
From 37 yards in, yeah.
Well, I mean, Doc, if we want to talk about Wade Ritchie, we can do that. But Ray Wershing?
He was fine. It was just a good thing that we were always winning most of our games.
It's fantastic. I love a good old grudge. One more medical question before we get you too far into the past. Hufanga with a Baker's cyst on his knee. Please explain, Doc. What is a Baker's cyst? Did it happen when he was in the kitchen?
Yeah, no. So a Baker's cyst is a benign cyst. So a cyst is any fluid collection anywhere in the body. They are really, really common to see when we get MRIs. They're especially common as we get older. So over 35, 40, 45, about 1 in 10 people will have some sort of a Baker's cyst. What it is that you get a little bit of fluid in your knee, either with injury or just physiologic amounts of fluid. It can slowly extravasate to the back of the knee. It can, in some patients particularly, be a marker of a meniscus problem or a cartilage problem. In many people, it's just an incidental finding. So for most of us, we just see it, we observe it, and it really isn't symptomatic. But if you've got to do a lot of explosive backpedaling, cutting, where that Baker's cyst sits is between your hamstring muscles and your calf muscles, so it can cause a little bit more irritation. So it sounds like he's already had some treatment for it. They've done an injection to try to calm that down, and I would imagine they'll just watch him symptomatically during the year. So it's something to keep an eye on, but I wouldn't imagine it really affects him too much as of now.
Doc, thank you as always, and when your shift is up, maybe we can gather in the waiting room to talk a little bit more about the history of kicking in San Francisco.
Oof, yeah, that's a long shift.
All right. Well, listen, we got a lot to discuss. Doc, thank you very much.
All right, take care, guys.
Okay, proceeding was sponsored by UCSF Health.